Okay, so we're working on the eye, okay? Like I said, we have 4 separate eye muscles on there. I'm just gonna wear gloves just because I've been touching a lot of people, so I'm just gonna make sure the area I'm working with is clean, especially around the eyes. Just to be aware of with contacts and stuff, we just make sure they have contacts or don't have contacts. You can still do this with contacts, just go lighter on the area. You don't wanna go too forced because then you're shifting the contact behind the eye or shifting it around. Okay, usually if I have my clients say don't wear contacts for your session, just bring your glasses for that one session so we can do this work. But what happens is with one of the eyes, so if I get Tess to look to the far left and to the far right, see there's this stagness right there with the right eye. Again, if I go this way, you can see the skipping with the right eye. See the twitching, the skipping. And then if I come closer to her nose for adduction, see the left eye doesn't want to move. Okay, so that means superior rectus is stuck on this side. Medial lateral rectus are stuck on this side. So now I know which one of my 4 eye muscles are gonna work on. What we're gonna do is get the client to close their eyes, and I'm just gonna come underneath and I'm gonna hook into that orbit of the eye through. Again, if I'm doing it on this side, you're coming in, and it's nice and light. There's not much pressure to this. I'm just trying to take pressure off the eye.
Together is fine.
Together is fine. I do it both just so I can get it done quicker too. So sometimes people don't like their eyes being touched as well too, or they have the light sensitivity, but this will decrease a lot of the light sensitivity, migraines, headaches, visual things. I've gotten people out of glasses because they didn't need the glasses because the muscles weren't moving properly in the eyes. Near sight, far sight. Okay, I can grab the eyeball itself, shift it around, move it side to side, back and forth. So far, I'm the only one that's ever taught eye massage before. I don't know anybody else is teaching this at all, but there's muscles in the eye, so I'm just like, if there's muscles in the eye, we can massage it, right? So you probably won't see this anywhere else. But it feels so much, especially with patients with glaucoma. Their eyes are swelling, so this helps to take a lot of pressure off of the oculomotor and optic nerve and through the outlets. You can see the nerve endings at the end where the 4 muscles are in the right picture up top. So if I can take some of that pressure off the nerve endings and help with that, it'll help a lot. Okay, and again, you know how I was telling you about the folds of the skin? So what I'm gonna do is just pull a lot of this out because it's the fascial tissues that are stuck because they're being pulled into the eye. Like I said, a lot of times it's not bags under the eyes that are being affected. Usually they say kidneys are drained in a Chinese medicine that cause the bags underneath the eyes. But with Tess, it's the facial nerve. So what I'm doing right now is stimulating the facial nerve to re-engage. But you can see I've almost corrected most of the lower eye already with barely doing any work right now. And then I'm adjusting phoenoid bone right now. So her phoenoid bone on this side is open, this side is closed. So what I want to do is open this up again. So I'm going to bring the phoenoid bone up and shift over. You see the difference already with that? And I'm going to hold some resistance against the phoenoid bone, and then I'm going to let it go. And then again, I'm going to pull it back into traction, pull a bit of tension on it, and then I'm going to let it go.
In a situation like this, how long would the person's eye look proper versus it going back to the way it was?
This usually lasts 72 hours or 2 weeks once I do it the first time.
And if you do it consecutively, then
it
it'll
holds
slowly go away?
longer and longer on that. There we go. And then I'm correcting here, and then grabbing the frontal bone. I'm just going to do a frontal bone lift with the phoenoid. But you see all the lines on the face are disappearing.
A new woman.
It didn't cost her $5,000 per face.
No, I got a lot of women that come to see me because they think this is a facelift technique. I go, no, it's just cranial sacral therapy. But you see already, look at the puffiness is gone underneath the eye. I just have to fix, you see this little bit in through here, so I'm gonna open the cheekbone up a little bit.
what are you doing? Which movement?
So I'm just spreading my fingers to open up the cheekbone. So zygomatic arch, phenoid, and I'm pushing to open the space. You got your concussion kind of here, right, Tess? Yeah, I can feel it. A lot of times when you're doing it longer, you can actually pick out where the head trauma was without even knowing it. I've had clients come in, don't even tell me, and I just, okay, it all happened on this side, and then they show me the picture of all the wounded trauma and all the scar tissue, and it's just by tissue feel. Okay, and then again, I'm just gonna do a slight ear pull just to even bring it even further.
Pull it. Just pull.
Yep, I'm pulling the two temporal bones down. And then I'm gonna come into suboccipitals because that's where the ocular, motor, and optic nerve control the eyeballs. Again, I'm gonna check, okay, extension's good. No flexion, okay? So what I'm gonna do is I'm gonna use my shoulder. I'm gonna push down, compress her, and then I'm gonna push her into flexion, and I'm gonna hold. And then I'm gonna take the shoulder pressure off, go back into extension, add a little bit over pressure again. Relax. Okay, now if I do it, see? So she was stuck with the way her head trauma happened. It feels like she got stuck like this for me, and then this got locked in through here. So that means she could not go into flexion. So by adding the overpressure, it was compressing, because some clients you need to compress them, some of them you need to decompress them. But because of the way her trauma happened, I needed to compress the head to get this to re-engage. Because remember on the thing I was telling SEM is over lengthened because of where her impact happened. It threw up in through here. So now if I move the head, I got really good movement back and forth, but look how different the face looks. And you can open up your eyes now, Tess. And then follow the finger again. See how much smoother that is with her eyes? No?
There's just one thing.
A little bit on there. There's still issues, so close the eye again. So I just have to get a little bit out
It's
on this
so
further eye.
difficult to notice. I can't even notice.
You're just
the
watching, you get pickier as the more you do it. So it's just practice.
So what do you have to notice? Like tickling
The
area?
eye has an nystagmus. It's twitching.
Twitching.
So the
like
one
very
that is
small.
twitching,
Yeah,
it's the
almost
one
like a
affected.
Yeah, it's the eye muscle affected. So the lateral rectus is not working on this one side. Okay, and then open your eyes again, Tess, and then try again. There we go.
Yeah.
See, it's nice and smooth now, and both eyes are moving together. Where we had one eye slowly lagging and back and forth. Okay? Any questions on that one? Okay, let's try that one out because this is a really, really cool technique for you guys to learn, and then we'll go from there.
Thank you.